So I guess I'll get started. So this talk, it's titled Health and Ergonomics, but health and ergonomics, my goodness, health encompasses everything. So what is this talk going to focus on? This is going to focus on a little bit of ergonomics, because a little bit of what you can do, day to day to help yourselves. But the health aspect is to sort of educate you to identify problems basically early, so that you can get the help that you need. So often I work with someone and they, oh, why didn't I come in last year when this started? Why didn't I come in 2 years ago? Why didn't I come in 10 years ago? And also when you have information, when you go to the acupuncturist, it's a problem with blood stagnation. When you go to the doctor, what are they going to do? They're going to try to fix things as much as they can with medication, injections, and surgery. So knowing a little bit about the problem just makes you informed, so you know your options. So it's about sort of general education about health, particularly health problems that I see from people from coming in from doing auditing work, specifically in office work, and just ergonomics in general. So here is a typical setup. There's these schematics all over the place for what does a good ergonomics setup look like. Some of these factors matter more than others, and some of them can actually make you worse depending on how they fit your body. In particular, for example, armrests. Armrests, I see armrests all the time making people sit worse. Why? Because it's just there, so they slouch to go and put their arms onto the armrest. And then if you remove the armrest, they actually sit much better. They feel better at the end of the day. If the armrest is right at the right height and makes them feel better, then use an armrest. But if it's making you sit worse, be conscious of that and don't use an armrest. Same thing with footrest. Some people like it, some people don't. So not necessarily that important. 2-3 fingers width distance, not necessarily important. Some people makes a big difference. Some people it doesn't matter at all. Some things that make a bigger difference than others, though. We're going to refer to this a few times. Is the sort of curvature of the spine there. When you have that little bit of an S-shaped curve here to the spine, that means that the vertebrae are more stacked on top of each other. It's actually less work for your muscles. It might not feel like it, but it is less work. So a lot of people don't sit all the way back. If you sit a little bit forward in your chair, like a lot of people do when they're working, learning to sit in this position, even if you're not leaning against the chair, is important. If you are leaning against the chair, having something to sort of encourage you to have that curve can be useful. The biggest thing I see is the monitor. The monitors are too low. People are working on laptops, or just the monitors just on the desk. That is too low. Because what happens if I'm working down, this is how I'm working, watch what happens to my shoulders and my neck is if I look up, automatically everything changes. Even this image here might be too low. I like about the eye level to be about here on the screen for myself. The only reason why a lot of ergonomics publications, research suggests this height is that if you do have it really high, that can sometimes lead to eye dryness because your eyes are so wide open. I haven't ran into that issue myself. I'd rather have my eyes wide open and stay awake, and my neck for feeling better. So I go a little bit higher than this for neck health, just a tad higher than this. But if your eyes are drying out, then you have to put down a little bit so your eyelids come down a little bit. Roughly at arm's length away. You might not think that's important, but we have a tendency to lean towards things if they're not within arm's reach. So your monitor should be within arm's reach. If it's beyond arm's reach, you might notice that you lean forward. You do this to get to it. So that is sometimes a quick fix. And these are all little things that you can do to yourself to just encourage you naturally without thinking about it into saying in a way that keeps you feeling good at the end of the day. So next, we're actually going to go to a health problem. So there's a lot of health problems. So I have a lot of words here. Carpal tunnel, pronator teres syndrome, thoracic outlet syndrome, cervical radiculopathy, double crush syndrome. Why did I put all of these together? All of these can create the same symptoms. So it can be confusing. Oh, I think I have carpal tunnel, so someone gave me this risk brace, it's not working. Well, maybe it's not working because it's the wrong problem. Because all of these problems can present the same. So most of these present or all involve nerve compression or nerve irritation, and it's normally a nerve called the median nerve. And of course that nerve has a pathway. If it's irritated at different points in that pathway, the problem is different. So carpal tunnel is a problem basically at the wrist. Pronator teres is a problem at the forearm. Thoracic outlet syndrome is a problem basically at the shoulder. Cervical radiculopathy problem at the neck. Double crush is if it's being irritated at more than one location. When we're talking about nerve irritation, the effect is more than additive. If you have a nerve irritation at more than one of these locations, it's not 1 plus 1 equals 2, it's 1 plus 1 equals 5. So sometimes it's just mildly irritated at multiple locations. You treat multiple locations and the problem gets much, much better. Or you treat just one and it gets better because it has such a huge impact. These can present as pain in the neck, shoulder, arm, hand, or fingers. Tingling and numbness, in particular for nerve pain. You get muscle pain, which also gives you that pain in the neck. But the tingling and numbness is more specific to nerve problems. In particular, hand weakness. A lot of office workers get hand weakness. I keep on dropping things in the sink. I have trouble turning doorknobs. I get people with these problems, and it's from office work. This grip strength weakness is probably the most common issue. Now, if you can get rid of the problem, the symptoms will go away. People, of course, just live with things for a long time before seeking help. Most cases don't require surgery. The carpal tunnel surgery, where they release the carpal tunnel, they go in and do a surgery, they just release basically a ligament that sort of covers the carpal tunnel, which is where the nerve passes by. That surgery has like a 30% success rate. Why? Because, well, they do the surgery pretty easily because it's a very easy surgery to do. So they're very quick to do the surgery. And B, you might have multiple problems and problems in other places, but the other places they don't do surgery on. So let's treat the one area we can do surgery on, and it's an easy surgery. But most of the problems don't require surgery, which is good. Sometimes it just requires, some of these problems I resolve in basically one visit. And if it's resolved, then some habits, exercises, and stretches can keep it from coming back. Particularly when it's muscle tightness pinching the nerves, I see it come back again and again. If it starts coming back, I start training the patients on how to, okay, this is the muscle I stretch. Do this exact stretch every day, and guess what? It doesn't come back because they do that stretch every day, it doesn't come back. Oftentimes when I do work on someone, it doesn't come back. Sometimes it does. So person to person, but often habits, exercises, and stretches are necessary to keep the problem from coming back. You can stop me if you have any questions. I will have some time at the end for a lengthy question session and answer session if necessary. So here's the thoracic outlet syndrome in particular. There's a lot of people who get neck stiffness a lot at the office. So this one's a pretty common one. And you can see the nerve here. It comes out of the neck, so you could have a problem at the neck. These muscles here are called the scalenes. These are the muscles in front right here. Oh, my neck is so tight, right? This can pinch the nerves between those two muscles. These muscles also touch the upper ribs. They can pull up the ribs and squish the vein, artery, and nerves between the ribs and the clavicle, basically the collarbone. As it goes through here, there's another muscle called pectoralis minor. It pulls the shoulder blade forward. If this muscle is shortened and tight, it can also pinch the nerve here. So maybe we have to just relax this muscle to resolve the issue. And if you've ever been cuddling with someone or you've been in one of those relationships where your arm, you're getting a lot of arm tingling, arm numbness, it's likely they're pinching you there. That's the problem. I hate having to say, well, maybe you need to take time away from the cuddling. Sometimes that's necessary, but not normally. Sometimes if I release this muscle, that's enough that they can resume the cuddling. But the combination of cuddling plus tight muscle can irritate that nerve. In these issues, they don't normally do surgery unless you have some sort of genetic variance. There's people with basically extra ribs. So in those very rare cases, they do surgery. But for the most part, what they do is you just stretch this muscle and relax it. Just stretch these muscles and relax it, and the problem goes away. These muscles in particular for the neck have a tendency of being, sometimes I stretch them and 30 minutes later, by the end of the session, they're already tight. If that's the case, the person basically needs neck rehab. So there is a solution even for chronically tight muscles. It's not just stretching. Sometimes you basically have to do neck rehab to get other muscles of the neck to be more active so that the muscles in the front get a chance to relax. If these are the only muscles your neck is using, then you relax them and the brain's like, why are you relaxing those? I'm using those. Right? So if you have chronic neck tightness, you get a massage and half an hour later, you're back to square one. Chances are you need neck rehab, neck exercise. This is probably the most common one, in particular for people who've had the carpal tunnel surgery and it didn't work. It's called pronator teres syndrome because there's a pronator teres muscle here. And we can actually stretch this muscle a little bit. I can show this one to you, try to. Some people, there's a bit of a trick to stretching this, but I bet you this is going to be tight in laundry. Anyone who uses a mouse a lot is going to have some tightness in this muscle. This muscle rotates the arm down. And if you're holding the arm down, then this muscle is going to be tight and being used all day long. We actually have two bones in our forearm, and they twist over each other. So they're actually crossed right now, and now they're parallel and crossed. And this muscle crosses them. So we'll go through this exercise now. So, muscle starts on the elbow here. So it starts on the inside, and it goes across just about like that. So I can place my thumb sort of going across, so sort of in the middle of my arm here. Now, I won't feel much because my muscles are holding up my arm. So I actually need my muscles to relax a little bit, so I need to put my arm down on the table or on my lap. So now my arm is just sort of flopping there. Okay. One of the best strategies for relaxing a tight muscle is called a pin and stretch. You pin down the muscle when it's relaxed, then you stretch the muscle. But because you pinned it first, all of that motion, all of that stretch goes right where you want, right underneath your thumb. So we'll actually cross the bones, we'll flip our palm down, we'll push down into our forearm, then we'll flop our arm open. And you should feel a tight muscle pop into your hand. Some people are, yeah. And other people I don't feel. If you don't feel it, probably you don't have an issue. But if you feel it, then this might be a good stretch if you can feel that. So you can flop, push, flop over, stretch. Relax the thumb, and flop it over, and just repeat pin, stretch. Pin, stretch. You stretch for about 4 to 6 seconds each time. So some people get benefit of that. Sometimes we practice that in an office. And that's just one possible problem. Okay. What about keyboards and mice? I have never once had a patient said that this helped them, or that they like this, but mileage may vary. The vertical mice people have had a bit more success with. So if that muscle, you can imagine that muscle is holding your mouse down all the time. If your hand is more open or more vertical, you won't have too much of an issue. The muscle won't be active all day. There is a cheap alternative to buying a fancy mouse though. What you do is you get a normal mouse, the mouse you already have, you go into settings, and you change the main mouse clicking button. How does that change things? Well, we click here. What happens to the human body when we're starting to click the other one is we rotate our arm to click. It's sort of like this. So instead of over all the way here, we're sort of, these fingers come up and then come down. And so that's about halfway to this position, just as a natural position. So that's something to try without buying an extra mouse. You just switch your main mouse button, and that sometimes fixes the problem. And sometimes it's enough to get over the nerve irritation as well. Nerves do get more sensitive the more they're irritated, so sometimes you just take it easy on the nerve for a while, for a few days to a week or two, and that lets the nerve basically heal and become more robust again and more resistant to irritation. Okay. This is a really, really big one. Myofascial trigger points, sometimes referred to as MFTPs or just trigger points. Everyone has tender spots in their muscles. I can find a tender spot anywhere on anybody, but most don't bother people, which is good. Myofascial trigger points are the nasty ones that cause pain when you move or just constantly. These form when a muscle has been asked to be tight for a long time. So these don't form because, oh, I worked out this weekend. Well, no, you worked out for 30 minutes. That did not cause these. This was from stress. You're holding your shoulders like this all day because it was super stressful. So 12 hours straight of this, well, the muscles in your shoulders, they're not designed to be tight for 12 hours straight. You get myofascial trigger points. I was sort of standing in line all day because of an event. Well, maybe your glute muscles, you're not used to that. Maybe your glute muscles were tighter than someone who's used to that, and your glute muscles have now formed muscle knots. So stress can cause them, or just being in a certain position for a long time to cause them. Sleeping position can sometimes also cause them. Imagine you're sleeping in a new bed, but psychologically your body is not comfortable. You're asleep, but a muscle is tight all night long. So you can wake up with one of these muscle knots. The bad thing about these muscle knots is they can last for years and years. I have people with, I've had this pain. I know one person, I was diagnosed with childhood arthritis, and I think they were 23, 24 of the hip. They said it wasn't that bad, but I just had all this pain, and I guess I just had to live with it. I haven't been able to sleep comfortably since I was like 12. I said, oh, that's awful. Let me check out the hip. Oh, we have some muscle knots. Let me work them out. My pain's 100% gone. So these can last a long time. Normal muscle knots don't bother people. These are nasty ones. As I said, they can cause constant pain or pain every time a person moves. The pain can be sharp, achy, burning, tingling, tight, pressing. Notice burning, tingling, those are more nerve-type symptoms, so it can be very confusing. Because if you go in saying, okay, I have tingling and burning type pain, the doctor's going to be able to think right away, and I think right away too, nerves. But these muscle knots can mimic nerve-type pain. The pain is often diffuse, it's often spread out over the area. You might have vague pain all the way down the arm, on the front of the shoulder, and the muscle knot might be in the back of the shoulder. You can have pain down the leg, and it can be up here. You can have pain in the knee, and it can be up here. So it can be very confusing with these muscle knots. These muscle knots are often responsible for, or partly responsible for, tension-type headaches, shoulder pain, hip pain, elbow pain, and quote-unquote sciatica. I'll take a moment to say why I put sciatica in quotes there. There is a nerve called the sciatic nerve that runs down the back of the leg. And while it's true that some pain down the back of the leg can be caused by that nerve, there's lots of sources of pain in the leg. The hamstrings, the glutes, other structures in the low back can just send pain down the leg, not necessarily along the nerve. But when a word is misused enough in the English language, the way it's misused becomes a new definition. Even if you look at the medical definition of sciatica, the medical definition of it is just leg pain. It's not pain from the sciatic nerve anymore. They changed that. It's now just leg pain because it's been misused too much. So, but if you know anyone who has, my sciatica again, well, it's not necessarily the nerve. It's not necessarily a disc. There's lots of things that send pain down the back of the leg that can still be referred to as sciatica. I find that really confusing because they look up the sciatica, oh, it's a nerve problem. Not necessarily. Okay. This works. Yeah.
Sorry. So if somebody's like sleeping and you constantly have this like tension pain in your shoulders, like if you crack their neck and stuff, and then you feel better, but you can't have your neck cracked every day, what's like a temporary remedy for it?
So there's a few different remedies depending on where that stiffness is. If it's muscle knots, then you can basically train your partner or your husband to work them out. If you're getting a response from the cracking doesn't get rid of muscle knots, but it does loosen the tiny muscles of the neck and the muscles very close to the center of the spine. Ways of stretching those and getting those to relax there's something called snags, sustained natural apophyseal glides. You basically take a hand towel and you take your hand towel and you basically put it right at the base of the neck, and so you wrap it around, you basically grab across your arms and you turn and you pull, basically use it like a pulley to get a deep stretch right at the segmental level, right at the level of the single joint. If I just try to turn my neck, all of the segments of my neck participate in that. And the more mobile ones are going to move further, and the stiff ones are going to not move, and they're just going to stay up there. If I want to target the ones that are tight, using that towel to really target exactly where that tightness is going to let you get that stretch right where you have that point. Another point for that specific problem, particularly if it's a little lower, if it's about right here, that's where I get my tightness, is a passive stretch. Just a long, passive, relaxing stretch. So how do you stretch the spine right in there? It's tricky. You can use basically the top of a chair and leaning back and try to get force right there, but you're more likely to hit your shoulder blades. So I combine a sort of firm edge that's not too firm that it hurts with basically a hand towel so you can get the force right where you need it. It takes, for a really, really deep stretch, a deep relaxing stretch, 15 seconds is not enough. 15 seconds might be good for preventing muscle shortening after a workout, but it's not enough to really lengthen something. Anyone who's done gymnastics or acrobatics knows that if you're working on your splits, a 15-second stretch is not going to get you there. I did gymnastics, and the first minute is basically you're just waiting for the muscles to start to relax. So it's the same thing if you're trying to really, really lengthen a muscle and really get something to relax. You might have to stretch something for at least a minute, up to maybe 5 minutes. So stretch longer than you think to get a real deep relaxation. Specifically with that towel thing, I often lie down and just put the towel pushing it right in there. And that works with me.
Sorry, I have a question.
Yeah.
Is it rolled up like long way and then you lay it on it like a sponge?
I have it sort of folded up into as tight a bundle as I can to get the force for me.
And what about a tennis ball?
Tennis ball can work for this relaxing, but it might be a bit almost too aggressive.
Okay.
Although tennis balls are not aggressive enough for working out myofascial trigger points.
Because I have a tightness just like where you're saying, and I'm not able to catch it, so it's just what I'm trying. I have a tennis ball.
Tennis ball inside of a towel or two towels.
Okay.
Different people, depending on the curvature of the spine and the shoulder blades and what they're leaning against, whether it's a yoga mat on the floor or their bed or a couch or the back of a chair, you have to sort of adapt to get the right amount of force there to feel it. It is more individual. Sometimes we practice in office in different positions with different amounts of talents of things, because you do have to experiment with your body. Okay, how to get rid of muscle knots. I think they should teach this in elementary school to everybody, or at least in high school, because everyone has bodies and everyone is going to get one of these eventually. I'm going to tell you exactly how to get rid of them right now. So, the treatment in the research, ischemic compression, steady pressure over the most tender point that causes the referred pain. You want to be right over that point. If you're right next to it, you might be pulling on that point, but you're not squishing. You need to squish the point. Ischemia is depriving tissue of blood. You need to squish the source of the problem. So this sounds painful, and it is, but don't let the pain get about a 5 out of 10, basically. Don't torture yourself. Within 60 seconds, if you're in the right spot, if this is the right treatment, the pain is going to drop. It's going to start to relax. If it doesn't, you're in the wrong spot, or it's not a myofascial trigger point. Once the pain drops, you can increase the pressure again. And then within 30 seconds, the pain is going to drop again. And you can repeat this cycle until you're basically, the pain's gone and it's just pressure. Now, it might be a very broad muscle launch. Maybe you have to do it a couple times right next to each other. Don't hurt your fingers doing it. They make all sorts of tools. If you don't have a tool, it's just anything that's sort of firm and round and soft. Basically, anything that's basically thumb-shaped or tip of the thumb shaped can work. I know people who use, not the pointy end of the screwdriver, but the handle of the screwdriver works great. The handle of a stirring spoon works great. What I have in office is it's just a plastic, there's a place for my hand, and then basically a thumb-shaped little nubbin that sticks out of it. And that's what I use in office. It's $10 off of Amazon. You just need sometimes something to protect your thumbs to get that steady pressure to get rid of things. I also do use my thumbs and fingers sometimes, but of course I'm working on multiple people a day. You're just working with one point, you can sometimes just use your fingers with this. This can eliminate it and get it gone. I will warn you though that these nasty muscle knots are full of chemical messengers for pain and inflammation. About 50% of people get a little achiness there the next day that lasts for about 24 hours. Not everybody, but about 50% of people. But it's gone. But it might come back. Sometimes I treat people, I see them 6 months later, do they come back? No. Okay. And other times they come back a month later, okay, it's back. Okay, now let's try to figure out why it came back. These can come back, basically, again, if the muscle stays tight. Is it the problem with stress? Are you not using your muscles properly? Do we need to do rehab? What's going on in your life that's keeping these muscles working too hard throughout the day? Okay, tension-type headaches. I treat almost 50% of my patients for tension-type headaches. You would think it's going to be neck pain, back pain. No, it's all headaches here. Everyone's working in offices. Tension-type headaches. They're a cousin of a migraine. They can sometimes mimic migraine. Lots of people who think they have migraines don't. They have tension-type headaches instead. Tension-type headaches are much more common. There is a genetic component, so if your parents have tension-type headaches, you're more likely to have them as well. So it's not just the office, but there's a genetic component as well. This headache is described as tension, pressing, achy, throbby, annoying. That's a very common one. Sometimes described as a tight band around the head. Most often it starts at the neck and travels through above the eyes. This can be caused by basically muscle knots in the shoulders, coming all the way up here, or muscle knots in the jaw, going all the way up here. It can be really confusing. But how does this work? Well, stress is going to make the brain stem, the brain, more sensitive to pain. So it's sensitive to pain. But what pain? Well, pain from muscle knots. So the pain from the muscle knots heads towards the brain. It goes by the brain stem, which is sensitive because of stress, and you have a genetic sensitivity to that brain stem, and it sets it off. If you can get rid of the myofascial trigger points, you can get rid of the headache. So many people walk into my office with a headache. I look for the muscle knots, I find one, I treat it. They walk out of there with no headache. I ran to a party, someone's like, oh, I have had a headache, and oh, do you have any Advil? She was about to take the pills. Whoa, hold on, give me 5 minutes of your time. No headache on me. She didn't have to take the pills. So this can be very effective if you can cut that cycle. Again, those muscle knots might come back unless you make changes to your ergonomics in your office space and your daily habits. Okay. So that's what we said there.
Sorry,
Yeah.
touching base when you said that the knots can come from the jaw. I often clench when I'm stressed.
Yeah.
So where's the tip for that? I mean, well, I don't realize until I'm feeling my head, which is happening now, and it comes from my jaw and I clench. So any tips for that?
Yes,
Sorry.
there are 4 jaw muscles. Sometimes there's muscle knots, and some of these muscles basically stay tight, and if just 1 or 2 of them stays really tight, they can tighten the rest of them. Sometimes I loosen up all 4 muscles and the problem goes away. Again, you can have these muscle knots that linger for years, basically making the clenching worse and the tension worse. And I find if you do a real thorough muscle treatment of all 4, so basically the easiest thing for me to say is come in for a full session to someone who does jaw, a physiotherapist or myself who does jaw, and we'll do all the muscles and see if sometimes it gets rid of the clenching. I had a boyfriend come in, because I treated the girlfriend, so thank you so much. She was grinding her teeth so badly, I was losing sleep. So sometimes it's just as easy as working out all of those muscles.
Okay.
There are jaw exercises as well. You can basically do jaw rehab and jaw exercises to keep the tension from coming back. But that's not normally necessary. If I treat the muscles and it comes back, then I give people all the jaw exercises.
Okay,
So you can look up jaw exercises. You can give that a try as well, just YouTube videos.
Thank you very much.
Okay. I'm a little over time. Can I continue to go? Okay. I have about 5 to 10 minutes left. So, sitting posture. Biggest problem people have is, I mentioned this S curve is missing. Look at this person's shoulders versus look at them here. People think, okay, I need to sit up straight, and they try to do it just from the shoulders. Well, if you're doing it just from the shoulders, you're just going to suffer. If you fix it at the pelvis, it fixes the shoulder. It fixes most of the people's shoulder hunching just by fixing the position of the pelvis. So how I normally teach this is, here's cat-cow from yoga. This is a good way of warming up to the pelvis muscles. I basically have people in office basically go as far back as you can, as far forward as you can, just stretch things out, and then find the point where you're actually physically the tallest. The point where you're physically the tallest is where those vertebrae are all stacked perfectly on top of each other, and where the job is basically easiest on your muscles. If this position is painful and it's uncomfortable, then get help. Because no wonder you don't sit properly, because it hurts. If this is just new, and this is different, it's not painful, it's just different, then it's normally a pretty easy habit to develop because your muscles actually like this position. I've never had someone take more than a week of practicing this when they sit down to make this into a habit. And in fact, most people say it took about 2 to 3 days. Because your body actually likes this position. It's just forgotten how much it likes it. So you just find this position and just practice every time you sit down. At first, you're going to look silly, going back and forth trying to find this position. Eventually, you'll find it very, very quickly, and you won't look funny in the office anymore. And it just takes a few days to make this a habit.
Okay.
Again, just to reemphasize, if you're sitting all the way back, you can get a little backrest. And if you're sitting on the edge of your seat, you should still have this curvature.
I have a question about that posture. For me, I like to feel like my feet is touching the deck so that I'm up. After we discuss, I need to be more level. But the thing is, I'm short, so my feet is downward. Like swinging.
Right.
So sometimes when I stand, I get the feeling like I need to get my feet like upside down.
Yes.
So I'm standing to activate that.
Yes. You're pinching some nerves gently at the back of your thighs because all of that weight is just hanging there for long periods of time. There's also a lot of the main artery that feeds blood to your leg also goes down the back of the leg. So you're squishing that a little bit. Obviously you're surviving, so it's not too much of an issue, but this is what footrests are for. You can get a footrest or a stool to put your feet on underneath the table. You can find some books that people are throwing out, or I'm sure there's a stack of documents that need to be recycled somewhere. Throw that into a bag, tie it to a bag, put that underneath your chair, and rest your feet on it. There are tricks you can make to find something to rest your feet on. That's the case where footrest is important. so that you don't get that sort of sensation? Excellent, excellent question. Pec stretches, I mentioned nerves can be pinched in the front. If you're going to do a long passive stretch, keep in mind you might need to stretch for 1 minute, 2 minute, 3 minute, 4 minute, longer than you think if you have significant tightness. Sitting posture, shoulders. Exercises like this are also going to help prevent muscle knots that cause headaches, assuming you don't have any right now. So, any exercise that activates these muscles, that pulls the shoulder blades back and down, is a good exercise to do. Any exercise. I don't like to be specific because everyone finds different ones feel better for them. So some people like to pull back and down, just like this. Other people like to pull down like this. Some people like to windmill the arms. Some people like to pretend they're firing a bow and arrow. Some people like to open up. Other people like to hold the shoulder blades down and rotate the arms outwards, which is what's shown here. In particular, I would not do these exercises half-assed, because there's a benefit to this exercise that's called reciprocal inhibition. By strongly activating the muscles that pull the shoulder blades back and down, you can tell the brain to deactivate the muscles that bring the shoulder blades up. If you do 1, 2, 3, 4, 5, 6 with that much vigor and effort, the brain's like, oh, that's super important. Let me relax these muscles to make it easier to get those shoulder blades back there. And that people can feel right after doing 2 or 3 of those, a 10 to 15 second workout, maybe 2 or 3 times 5 seconds. 95% of the time after I have someone do that, they're like, wow, my shoulders feel really relaxed. Just as relaxed as getting a massage, because it can turn off those muscles. I mentioned muscle knots form when muscles have been asked to stay on for too long. Doing this about once an hour can prevent muscle knots from coming back. Research suggests every 15 minutes. Whoa, that's way too much. You have stuff to do. You're on a roll. But basically, from clinical practice, from feedback from patients, I find that once an hour seems to be enough to keep muscle knots from coming back. In general, I recommend doing something. Even if you're not doing this exercise, just shimmying in your chair, bending side to side, something. Even if you have perfect posture, if you work 12 hours straight, you're going to get muscle aches and pains. So once an hour, even if it's 20, 30 seconds, you just twist, shimmy, anything is going to help. So neck posture, monitor position is going to be the most important thing. Neck retraction type exercises, basically chin type exercises, might help. My favorite is, particularly I tell people, if you're stuck in the car has a headrest, push against it for 6 seconds a couple of times. If you're stuck at a red light or stuck in traffic, you're not doing anything else, right? You might as well do neck exercises. That might help. The neck can be much, much trickier. There's a lot going on in the neck. But those exercises sometimes help people. Stretching these muscles might help. Some people, as I said, with some people they just tighten back up. Looking up might help. What do I mean is your capabilities shrink to what you do every day over time. If you never look up, if you never tilt your head side to side, you're going to start to lose the ability to do so. And your neck is just going to feel tighter and tighter and more restricted. So use your range of motion of your neck a little bit every day. And that's going to keep you from losing it. And particularly 5, 10 years of office work, I get people and they tilt their head and they fall over or it's so tight. They lose their balance. Their neck isn't used to moving side to side. They haven't done it in 10 years. Okay. I think this is the second last slide. We're getting to the end here. Some people benefit from one of these lumbar supports. Other people don't. It depends on how you sit in your chair. I love the idea of standing desks. It gives you a chance to go from sitting to standing, sitting to standing. Variety is good, moving is good, so that can help. Look at how high these monitors are. That's the way it should be. Even getting that laptop up so the screen is up high. That's sort of a necessity for the neck and the shoulders to feel good. Exercise balls. I love exercise balls. I use one as my kitchen table chair. But they're a workout. If I'm actually sitting at my table and typing or something, after about an hour, I need to lie down for a bit. So I don't, and if you look at the research, they don't recommend exercise balls to replace office chairs. It's too much work. That being said, I do recommend offices to purchase an exercise ball for the office, to make them available to people to use for 20 minutes at a time, 30 minutes for a time, or when they're taking a 5-minute break, to just roll over the ball and just stretch their pecs over, because it's nice and gentle. Maybe you lie with the ball and do a couple of crunches on it while you're at it, activate your abs. It'll make working the afternoon just feel better. But so exercise balls are awesome things to have for the office to use, sometimes for sitting. Some people are gung-ho and they replace their chair with one without trying it first. It is a lot of work, it's more work. Some people can do it, but it's a lot of work. This is the last slide of information here. Nutrition and deficiencies. Taking extra vitamins and minerals doesn't really help. If someone said, oh, magnesium helps me for my muscle twitches, I'll take extra magnesium, it might not help you. But, because it only helps if you have a deficiency. So because deficiencies are the only thing that matter, I often tell people, everyone I tell, take a multivitamin, take omega-3s just in case, just to catch some deficiencies. So that's a very vague recommendation. Some common deficiencies and some of their symptoms are here. A deficiency in omega-3, chronic inflammation, fatigue, poor memory, dry skin, heart problems, mood swings, depression, poor circulation. Those can all be caused by a lack of omega-3. Magnesium, fatigue, muscle cramps, mental health conditions, iron, weakness, fatigue, vitamin D, multiple sclerosis is caused by a lack of vitamin D, osteoporosis, fatigue, muscle twitches. Inflammation is actually also under vitamin D as well. I also included, and I included this in the handout as well, a website which gives pretty good, just generic health advice. You can look up health conditions and they'll suggest what deficiencies you might have. You can also look up health supplements and find out, if someone told me about this, and you can look up that supplement or that vitamin here and find out, okay, what's that good for? And what's the research? It'll actually have a little article, a little blurb about the research, about how much research supports it. They have a star rating system. And so having resources like this is just useful to have in your back pocket when you or a loved one has a health problem. You have to do somewhere to go for some reliable information. Okay. There's other topics we're not going to get into, but I can help with all sorts of issues.